Okay, this is the third catheter change in about how many weeks? A month, 6 weeks. Right, I have all the kit ready. I haven't got any flow at all. I don't care about my mask with my nose dropping, as long as my droplets in my mouth don't go down there. Like I says, what I'm going to do first is I'm going to try the balloon. So this is the syringe that you use. I can take the cap off as gently as I can. And what I'm going to do is I'm going to blow it up. And what I might do is add two. Can you see that? Can you see it then?
No.
Just to show that it works. There's 10 in. Can you see the balloon? Just show you a little bit more that it works. I don't know whether anyone can see that. There's no leakage.
Yeah, it's not going down, is it?
I'd love to push it and give it a good old tug.
Squeeze.
Yeah, what I do is I might do that actually. Where is the right, I've got a sterilised pad here. So I'm going to wrap it around that. And just make sure, give it a little press, a little wiggle. Right, his SAT's a 93, his blood pressure's a low, and there's nothing coming out. So what I can do now is I can draw that fluid back. So saline will be drawn back. Come on, you little bastard. That is weird. It's not drawing back.
What?
I will put an extra mil in that. It is now. It's probably me and my bloody hands. I've got to get the whole of that out. You can't put that in the body like that. So I've lost probably a little tiny bit. We'll soon see.
How much?
I actually haven't lost any. It looks like I did lose it, but I haven't. So I'm going to pop that there.
So that's good to go then?
It is. There's my 10 mils that I'm going to pop back in. And what I've got to sterilise stuff around here. So what I'm going to do is overinflate the balloon so it stays in place, which overinflation is when you first put a new catheter in. You can put up to 12 mils. Done it loads of times. So I'm just gonna, all this side is sterilised, all this side is sterilised, and I'm trying to get this catheter to go in and to stay the F in.
It will, I think.
I hope so. I can't flick the end, come on. So I'm going to put 11 mils in. That's ready to go. No bubbles, no air, no nothing. So let's hope that this works. So now I'm going to draw this back by using, you don't have to put sterilised gloves. There's the nozzle. This is the size 18 coming out. I only got 200 mils. The rest has come out through the urethra. So yeah, this I have 10 mils. You're going to get that resistance until you've got your 10 mils back. Once I've got my resistance, that should be able to, good to go. I'll just check first, not overbend, and I'll just double check. That's my 10 mils that went in earlier. So my dirties I'm going to put across the other side of the sterilised pad. It's just, I've never known catheters to fail so badly. So my next step is, obviously I'm going to put some sterilised gloves on now. So I use Ben's body because it's easy. It makes my life easier than using a tray or using anything else. So I'm going to pop that. I've just split it, but I've only split it there. So you know what? I'm not going to use that area anyway. And you can pick that glove up and you can touch that bit there. because this is going to be my dirty hand.
I got cramp
Where?
because I've got this on my arm.
Mate, I need to get this out as quickly as.
No,
So what I've done is I've put some instiller gel around the area, which is a local anaesthetic. And then I've got another instiller gel and I will push that into the catheter as soon as I get the catheter out. So catheter's ready. So now I'm ready, I can touch all this sterilised stuff. So I'll pull the catheter out and I'll pop it into the catheter tray, which I'm going to use the one down here. And it remains there across all that sterilised stuff. I'm trying to do it as slowly as I can for everybody. Always check your dates with everything that you've got. So I've already took the nozzles off. I've prepared myself for a catheter change. I'll give that a good, I'll take it about this far up because when I pop it in, it'll go in. So my dirty area. So as soon as that comes out now, I will then put, sorry, I've just had to eat some peanuts. And then I'm going to see now what comes out of here. So always be prepared with something. Put a little pad across the area, lift up the stoma as usual. It wasn't in. The piss has come out. Did you see that? I hope that got caught in there.
It wasn't even in.
No. That's absolutely freak. I'll blow that back up. I'm going to have a look at that dirty catheter once I'm done. So what I'll do is, because there is some blockage in there, but not at the top, it's halfway down where the balloon is. Believe it or not, that is the balloon.
I can't believe it wasn't in.
No, I'm going to put it over here because I do need to check that balloon for other people. And not just because of you. And because he's had some retention, I'm just going to make sure. So I'll show you the stoma. Hang on. Before I put a new one in. Let's get these gloves off. And I will show you what the stoma looks like. You alright, my love?
Yeah.
So you always give a good reading. Take this round. You're going to see his butty is cute little ass. And then what I'm going to do is I'm going to open this up and show you it's a clear stoma. And no retention because that's all just pissed out. So there's nothing there. I'm going to give this a little. So there you go. That's just proved that the stoma's clean. Stoma's healthy. I'll grab some gloves on and we'll get that in. Get a new one back in. And I will check. Yeah, he's got low blood pressure, so I do need to get on really quick. And for quickness, I have these gloves, which are quite easy to use.
That's what you're going to put the new one in there.
So I can use dirty hands. This is all sterilised. So what I'll do is I'm going to go into the stoma and I'm going to pop the instiller gel in there. You all right, my love? I can't wait to check that balloon. Are you okay?
I'm fine.
So SAT's a 97. So that's pretty cool. Hold on, there's a glove. Let's get another glove on. So I'm double gloving and then I'll triple glove on my right hand. And it's just in case it doesn't go in. I don't know. But I don't know. I haven't got a clue what's going on with these bloody balloons, but they're a ficking nightmare.
Well, that balloon can force it
This
out.
is going to be dirty, so it doesn't matter. This is my clean one. I'm ready to pop that in. I've got my 10 mils ready. And so pop your hand into a sterilised glove. Use the steriliser onto the person's body.
Grab the new one.
Give it a good
away
old,
you go.
yeah, and absolutely, there it is. There's the instiller gel, and in it goes. You all right?
Yes.
There, I've got flow. Again, there's old blood coming out. I don't know whether the actual camera can see this, but I've got some debris. Got some crap, and he's got to feel relieved after that.
Damn right, no more idea.
No, I'm on at all.
No.
It's absolutely weird. So I'm going to cut this around my finger and around my thumb.
Bit sore inside.
You're going to be sore. I'm removing the package because it slips on your fingers. And then I'm just going to blow the balloon up inside. Come on. Hang on. I can't do it that way, I'm afraid. That's just not working for me. I'm just trying to hold it in place at the same time so it stays in place. I just need to get that balloon in situ. Once the balloon's in situ, which is going in now, locking off, throw that. There you go. And we have urine. That is absolutely crap that's coming out of him. What I'll do is I'll sterilise this whole bag. But yeah, there is a lot of sediments coming out of that. And what I'll do is I will blow this balloon up now. And just to show that what is wrong with that yellow stuff that's around it. It's really bizarre. That is what you call a catheter change.
I'm just glad it's done now.
You alright? Are you feeling okay?
Yeah.
So I've got an old syringe here with some urine inside. So what I'll do is I'll bring this back to the camera.
Oh, you tested it?
I'm going to test it because I will then phone the hospital and tell them I can touch it all because it's disgusting. I'm not going to bring it near Ben. I'll pop it in my sterilised area and then I'll see what's going on, look. It's all around the balloon, look. Yeah. That is strange. So I'll cap off and show you. I don't know why, but that balloon does not look right to me. And I've been doing this for many, many years.
Squeeze it.
Over 26 odd years. And at the top, there seems to be something wrong. And around the actual balloon itself is not, it's not normal. Can you see that?
That's
so
why.
You know?
That's why it was out.
And I'll show you now. I've got to deglove first. Did get the whole lot off.
That's why it stopped working.
It did stop working because of that. Right, and I will show you now. My gosh, what a nightmare. What a 2.5 hour morning we've had.
Breakfast.
No, I had to have a Snickers bar, mate. I was starving. Yeah, but your sats have gone to 98. Your sats are brilliant. And also, I've got complete flow. Look.
You have now, love.
And catheter's absolutely warm. Brilliant, we've done it. There you go, darling. How do you feel?
Good.
So what I'll do now, right, is because I touched the catheter, obviously, I have wipes. So I'll wipe that, I'll wipe the bag. And then what I'll do is I've got sterilised wipes here. So you can sterilise, obviously, the tube all the way down, which is what I'll do, just to make sure that there's nothing at all that can cross-contaminate Ben, because I do believe it's catheters. There's no way.
There's no way that would have happened.
I haven't done
this. There was no blockage.
Years and years and years. Since he was a child, I don't think.
Told you there was no blockage.
You've got no blockages. You've got nothing. It was the actual balloon, just as I thought. So, yeah, that's a suprapubic third catheter change.
Failed.
And a failure of a balloon.
Damn.
And if you see the other balloon, if you go back to another video, your other balloon is round, obviously, but it's all equal. That was lopsided. So how do you feel now, my love? And you'll do 2 more readings, right? Because that was very low, look. Oh, it was 90. It was low. So we're just going to check this out now. Make sure he's got a good reading. So it only took 15 minutes, but I was slow to do it. Normally it only takes me about 2 minutes. Oh, I can have my mask off now. Come on. 105, 66, 71, 97. So it's okay. It's all that will work now. I'll do 2 more readings and I'm going to get them cleaned up and washed.